I do believe that just because we're a rural area doesn't mean that we shouldn't have access to great health care.
When you have less access to care, things kind of go under the rug.
Healthcare is at the forefront of everything. So I think when we have somebody in charge who wants to invest in the people who are going to help our citizens, it means that we're heading in the right direction. My name is Adam Unmacht. I live in Millersburg, Pennsylvania, and I'm a family medicine resident.
I'm Mandy Manival. I live in Richfield, Pennsylvania, and I am an academic family physician.
My name is Madeline Marone. I live in Mifflintown, Pennsylvania, and I'm a registered travel nurse.
I ended up here in Mifflintown because I was born and raised here. So this is a community that I really love, and it's my home.
It was really nice to grow up with people that you know. The community is very supportive, feels very tight-knit.
When looking to pursue a career, I was trying to find something that I felt like would be able to give back to the community because I never wanted to leave the area. So, being a physician seemed like one of the things that we needed most in the area.
Definitely, I felt a calling just to serve. I wanted to be in service of other people. And it just turns out that nursing just happened to be the best path to that.
How many years did it take you to get qualified?
High school is a quick 4 years.
And then 4 years of college.
4 years of medical school, and then 3 years of residency.
It's a lot of years.
Yeah, it's a lot.
A couple of things, I guess, that are difficult about travel nursing. Every hospital and hospital system does things differently from one another. So I got one shift of orientation, so 12 hours to learn kind of the entirety of it until they kind of drop you in there and they expect you to do your job, which of course we're ready to do, but that's also very challenging.
So practicing in a rural community has a set of challenges that I feel are pretty unique.
I like to think of what we do as rural family docs as we are all the specialists in one, because if we have to send somebody to dermatology or some of the more specialized practices, it could take 6 months to a year until they get seen. I think we have a leader in the state now who is investing in the healthcare workers. If you invest in healthcare, you're investing in the citizens of Pennsylvania.
Most medical students graduate with a tremendous amount of debt, student debt. And so things like loan repayment, investing in rural hospitals so that, rural docs can work in their community and not burn out, and that they can really, follow their passion and see themselves in a career here. Those things are fundamental, I think, to sustaining healthcare in rural communities.
I think Governor Shapiro's plan is great, providing monetary support to nurses, the support staff, so our CNAs, patient care technicians, they are truly the backbone of healthcare. They make our job 1,000 times easier, and when you don't have that help, it shows.
We've shown in Pennsylvania an ability to solve problems, an ability to bring people together to tackle these big challenges. This is the next thing we have to solve to deal with our healthcare challenges of tomorrow.
Funding into rural hospitals, it's going to provide jobs for people in the local area.
I don't see myself leaving Mifflintown. I love the challenges here. I love the people. I love the fact that I can train students and residents here, and then hopefully, my love for rural family medicine will rub off on them and we can retain them here in our community.
The opportunity to serve the community that has taught me so much and it has given me so much is just fulfilling. It's very fulfilling.